Today, you are not just watching surgery, you are learning the exact English used inside real operating rooms. Instruments, anatomy, commands, roles, and responsibilities. Everything you need to function in English as a medical professional. First, just watch and listen. Second, pause and repeat each term out loud. Third, use the phrases in your real clinical practice. Part 1. Operating room, key objects and areas. Operating table, where the patient lies. Sterile field, clean area where no contamination is allowed. Mayo stand, used for surgical tools. Anesthesia station, equipment for monitoring and sedation. Suction apparatus, removes blood and fluids. Phrase, maintain the sterile field. This means do not contaminate the clean area. Common instruments. Scalpel, small sharp knife for incisions. Forceps, used to grasp tissue. Retractor, holds tissue open. Hemostat or clamp, stops bleeding by closing vessels. Suction tip, removes fluids during surgery. Sutures, used to close wounds. Phrase, pass the forceps, meaning give grasping tool. Apply a clamp, meaning stop bleeding. Part 2. Basic surgical actions, verbs you must know. Incise, meaning to cut into tissue. Dissect, meaning to separate tissues carefully. Retract, meaning to pull tissue back. Clamp, meaning to close a vessel. Ligate or tie off, to secure a vessel with thread. Cauterize, to burn tissue to stop bleeding. Irrigate, to wash with fluid. Suction, to remove blood or fluid. Close, to suture the wound. Example in context. Incise the skin. Now dissect deeper. Retract the muscle. Clamp that vessel and ligate it. Part 3. Anatomical language, direction and position. Anterior, meaning front. Posterior, meaning back. Medial, meaning towards the center. Lateral, meaning towards the side. Proximal, meaning closer to the body. Distal, meaning further away. Superficial, meaning near the surface. Deep, meaning further inside. Example, move laterally means move to the side. Go deeper means continue inside the body. Part 4. Types of bleeding and control. Bleeding, meaning general blood loss. Oozing, meaning slow, mild bleeding. Hemorrhage, meaning heavy, dangerous bleeding. Control phrases. Control the bleeding. Apply pressure. Clamp it. Suction here. We have a bleed. Important term, hemostasis, meaning stopping bleeding. Part 5. Roles in the operating room. Surgeon, performs the operation, makes decisions, gives commands. Scrub nurse, maintains sterile field, passes instruments, anticipates surgeon's needs. Circulating nurse, not sterile, manages equipment, documents procedure. Anesthesiast or anesthesiologist, controls sedation, monitors vital signs. Part 6. Isolation or separation rooms, important for nurses. Key terms. Isolation room, patient separated to prevent infection spread. Airborne precautions, infection spreads through air. Contact precautions, infection spreads by touch. PPE, personal protective equipment, gloves, gown, mask. Nurse duties, put on PPE before entry. Remove PPE safely after leaving. Dispose of contaminated materials. Monitor patient condition. Limit unnecessary contact. Common phrases. Put on PPE before entry. Dispose of waste properly. Avoid contamination. Patient is in isolation. Part 7. Real clinical sentences. There is active bleeding. We need better exposure. Retract the tissue. Suction the area. The field is not clear. Close the incision. Prepare for suturing. Now you've heard how surgery sounds in real English. Want real practice? Comment "task" below. I'll send you a full PDF with exercises to drill this vocabulary.
Follow for more Medical English Pro.